Hello, this is Lascano about to perform a central line dressing change here. Before I begin, I'm going to go ahead and perform hand hygiene before entering my patient's room. Enter my patient's room, I'm going to introduce myself, let them know that I'm going to be performing a central line dressing change, and then I'm going to go ahead and get through my uh, checking of orders, make sure that my patient is my patient, so check patient identifiers, all that good stuff before going ahead and getting ready. So assuming I've already gathered my supplies, which really just consists of a central line dressing change, I'm ready to go ahead and perform the procedure. So, of course, hello there, Mr. Patient. I am Kai Lascano, here to perform your central line dressing change. So let's go ahead and get started. I'm going to go ahead and perform hand hygiene once more just to make sure our hands are nice and clean. I'm going to go ahead and do a quick assessment on our dressing that's currently on there now. So looking at it from here on our patient, I'm just going to say it's clean, but since policy at UCMC is we change central line dressings every Thursday, and today's Thursday, I'm going to go ahead and get it changed. So I'm going to go ahead and throw on some clean gloves that I have here. And I'm going to go ahead and open up my dressing change kit. Now for my dressing change kit, I'm going to go ahead and procure the mask from the kit, and I'm going to have my patient wear it, right? Just so they do not contaminate the field. Not really sure how I'm going to do this here, but yep. Okay, well anyway, our patient is now wearing the mask, so I'm going to go ahead and tell my patient to turn away from the central line dressing, just so they don't have to or don't have the opportunity to contaminate the field. But I'm going to go ahead and take off the old dressing, making sure to kind of pull towards the direction of where the old central line is. And this is unfortunately, a really not well done dressing change from the previous person, so I'm just going to assume that we are taking this dressing off properly. Okay, so now that we have taken off the old dressing, I'm going to go ahead and switch gloves, or not switch gloves, but take my gloves off, right? I'm going to go ahead and perform hand hygiene, and then I'm ready to perform my dressing change. Yeah, so here we go. I'm going to open my kit, right? I'm going to grab my sterile field, make sure to open up the sterile field using only the corners with the shiny side down. Okay. Awesome. And then I'm just going to go ahead and grab my entire kit here and just dump everything. Well, actually before that, I'm going to go ahead and grab my sterile gloves, which is also on top of the kit. And then while doing that, I'm just going to take all the contents in here and just dump them in my sterile field. Okay? So, now that I have all of my items, I have my sterile gloves. I'm going to perform hand hygiene and go ahead and don my sterile gloves. So, while donning my sterile gloves, I just want to make sure that I am performing sterile procedure while doing this. And making sure that I'm putting on my gloves the sterile way. Okay. This is taking a quick second. But now, once I've donned my sterile gloves, I'm ready to perform my procedure. So, I'm going to go ahead and grab my chlorhexidine scrub. I'm going to break it. Okay? And I'm going to go ahead and scrub away at the dressing, or the site of the dressing change. Okay? Make sure you get every inch of where our dressing is supposed to be at. Okay? Gonna wipe some on the hose here. Okay, so now that this is dirty, I'm going to place it here in my trash. And then next I'm going to go ahead and grab my protective wipe, which I'm going to pretend like I'm opening it so I don't waste it. But let's just go ahead and open this, okay? And then I'm going to go ahead and put some of those wipes onto my patient, okay? Making sure that my hand is still technically clean. Okay, once my protective wipe is on there, I'm going to go ahead and dump that. And then I'm just going to go ahead and grab my new dressing. So, performing this sterilely. Okay, I'm going to grab my dressing. Okay, I'm going to open it up. Okay, and then I'm just going to go ahead and stick it onto my patient. Making sure that the site is still exposed so that we can assess it later on, alright? I'm just going to go ahead and complete. Oh, that part comes off. You're going to go ahead and completely take off the rest of this, like so. Bear with me as I attempt to take off this dressing here. There we go. All right. Now that my dressing is secured, I have access to the site. I can assess it if needed. And now I'm just going to grab this portion, which came off at the bottom, and I'm just going to go ahead and unwrap this and then pretty much just secure the rest of this onto my person, and then we are good to go. Before I finish my procedure, so I'm going to go ahead and clean up really, really quickly. Before I finish my procedure, I'm going to go ahead and grab a pen, and I'm going to grab a little information packet here in my kit, which has the date, time, and name. I would put this and write down the date, time, and my initials on here, and I would stick it right here onto my patient, and then they are good to go. So that is how you perform a central line dressing change.